Hello, welcome to Medical Dialogues. I'm Roshni Dhar and I'm going to talk about Mr. Ashok, a factory worker who faced a life-changing accident, losing his right hand on 7th of April. Thanks to the skilled team at Sir Ganga Ram Hospital, led by Dr. Nikhil Jhunjhunwala under the supervision of Dr. Mahesh, Chairman and HOD of Plastic Surgery Department. Mr. Ashok's journey to recovery saw a remarkable turn through a complex surgery. His hand was successfully reattached, marking a triumph of human perseverance and teamwork. To talk about this case in detail, we have with us Dr. Mahesh Mangal, Chairman, HOD, Department of Plastic and Cosmetic Surgery at Sir Ganga Ram Hospital, Dr. Nikhil Jhunjhunwala, Associate Consultant, Plastic and Cosmetic Surgery. Welcome to Medical Dialogues, Dr. Nikhil and Dr. Mahesh.
Hi everyone, I am Dr. Nikhil. I am a hand surgeon at Sir Ganga Ram Hospital.
So, Dr. Nikhil, starting with you, can you tell us the case history and the technical challenges you faced?
So, this patient came actually, it was 28-year-old male. He was working in a wire factory, and while working, what we saw in the CCTV footage was he was continuously talking to someone on the headphones, and a single span of attention deficit caused him his hand, because the hand got entrapped in the machine and was completely amputated from the level of wrist joint. This happened at around 3:30 p.m. and he presented to us at around 7 p.m. in our emergency. So we immediately took the patient to the operation theatre for the reattachment surgery. The technical challenges actually is very demanding, because we commonly, for your information, the Sir Ganga Ram Hospital is actually a center of excellence in reimplantation surgeries, which is headed by Dr. Mahesh Mangal. So we commonly do reattachment surgeries for the fingers, but the hand amputation at a more proximal level is very uncommon. So at the level of hand, you have to not only attach the neurovascular structures, that is the arteries, veins and nerves, but you also have to attach all the tendons and the bones, which becomes a difficult job because you have to finish it fast to prevent the reperfusion injury. We took around 8 hours to complete the surgery and finished it. The patient was discharged at 5th day with good hand vascularity and the patient in stable condition.
Right, so what were the prognosis?
Once the reattachment surgery is successful, the patient can use his hand like a normal hand. The prognosis of all the reimplantation surgery is very good.
Right, thank you, Dr. Nikhil. So, Dr. Mahesh, is there anything else you'd like to share or add?
Basically, important thing is that I told you that once this accident took place, the question remained to the patient or to the attendant is that what to do basically. One important thing is that because the once part is amputated, there is a lot of bleeding from the stump, because they are the main arteries. There is a lot of bleeding from that area basically. So important thing is that at the site, that immediately you have to stop the bleeding by pressure or by elevating the hand, because if there is a lot of blood is lost, then the patient becomes sick. So first important thing is the first aid by stopping the bleeding. Second important thing is that if the part is how to preserve the part. That is a very important thing. If the part is not preserved properly, then sometimes the replantation of the part is difficult, or there is a failure. So second thing is that the public or the must aware that how once any part of the hand or any finger or thumb is totally amputated from the body, then you have to preserve it properly so that it can be utilized, and patient then has to rush to a replantation center where the commonly replantation surgeries are performed.
So, Dr. Mahesh, as the chairman, how have you seen the Department of Plastic Surgery evolve over the years at Sir Ganga Ram Hospital?
We are doing these kind of surgeries for last more than 30 years. Ganga Ram Hospital is a center of excellence, and I think in a month we are doing all kinds of replantations of the thumb, fingers, hand, arm, etc. And recently, you know that we have done a hand transplantation because there is a patient of a bilateral amputee which he lost both of his hand in a train accident 2.5 years ago, and then we have transplanted both the hands from a brain dead patients. It's a miracle basically. It's a first time it has happened in Delhi basically. So we are expert into all these kind of microvascular surgery and hand surgery, and every day we are doing a lot of these kinds of surgeries. So we are expert into. Basically, the hand surgery is now developing as a separate entity. Right now, the hand surgery is looked after by either the orthopedicians or the plastic surgeons. I'm a plastic surgeon and I have a special interest in hand surgery for more than 30 years. So I'm trying to develop a hand surgery in Sir Ganga Ram Hospital because now it's a separate entity or a separate specialty. Because hand is an important functional part of a body. So if anything goes wrong basically to the part, or if anything happens, maybe an injury or tumor or basically infection, or there is a lot of congenital or birth defect in the hand, we have to treat these patients accordingly.
Right, that's really nice, doctor. So, Dr. Nikhil, would you like to elaborate on the preservation techniques for hand amputation as discussed by Dr. Mahesh?
That about the what you say preservation of amputated part. So I would like to highlight on that. Whenever if your channel, how many lots of people will see your video. So I just want to tell them how to preserve a part whenever a part is amputated. First information is any amputated part of the body can be reattached if it is preserved well. Any amputated part of the body. So how do you preserve it? Whenever the cut body part is there, the first responders or the patient or their relatives should always look for the cut body part. What the patients most commonly do is they come to the hospital without the body parts. Once you get the body part, put it in a polythene and put the polythene in another polythene full of ice packs, and make sure that the part and the ice packs are not touching each other. It should just be hanged in a big polythene with an ice pack, and then go to your nearest center of excellence where that part can be reattached. Always look for the amputated part at the trauma scene.
Right. Thank you so much, Dr. Nikhil and Dr. Mahesh, for your valuable insights and for your time. Case was managed extremely well with tremendous efficiency and expertise of Dr. Mahesh and Dr. Nikhil along with their team. Salute for giving new lease of life to the patient. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.